A personality disorder is defined as a deeply ingrained and maladaptive pattern of behavior that persists over many years. And there's the 3 P's of personality disorders that help figure out what exactly counts as a personality disorder. And the important features are that it needs to be pervasive, it happens in a number of different settings, it's persistent and not something that fluctuates, and it's also pathological, where it causes a certain degree of essentially social dysfunction in the patient's life. The way that personality disorders are categorized has actually changed quite considerably recently. So I'm going to talk about the old classification system and the new one, just because you'll probably come across both. So they used to be grouped into clusters, so cluster A, B, and C, because they shared some similar features. So cluster A was thought of as the odd cluster, and it contains paranoid personality disorder, schizoid personality disorder, and schizotypal. B was thought of as the dramatic cluster, so that includes histrionic personality disorder, emotionally unstable, and antisocial personality disorder. And finally, C was considered the anxious group, which was avoidant, anancastic, and dependent personality disorder. So you're likely to come across the cluster system at some point. However, the more up-to-date version is the ICD-11, which basically divides personality disorders based on 2 criteria. So one of them is a severity, so mild, moderate, or severe. And the second is the trait domain, so the aspect of their personality that tends to be affected or considered pathological in this case. So I'm just going to go through the trait domains to explain what each of them mean. So negative affectivity means that there's a tendency for the patient to experience a lot of negative emotions, and they tend to be out of proportion to the situation that they're in. Dissocial trait is when they have a disregard for other people and hence tend to be quite self-centered and lack empathy. Disinhibition is when they tend to act quite rashly without thinking really about the consequences of their actions. Anancastic is a little bit like OCD, where patients have a very rigid standard of perfection, and they will try to control their own behavior and others' behavior to conform to their ideas of what counts as perfection. And detachment is essentially a tendency to try and avoid being emotionally close to other people, so wanting to maintain some distance between yourself and others. The biological management of personality disorders will mainly focus on SSRIs and antipsychotics. The psychological management will include a number of different types of talking therapy like CBT and dialectical behavioral therapy. Dialectical behavioral therapy is actually a type that tends to be most commonly used for emotionally unstable personality disorder. There's also a few other sort of group-based methods that can help patients with personality disorders, like therapeutic communities and arts therapy.